Hey, welcome back to Queen's Generational Wellness. I have Coach MT with me. She is a mental health nurse. Coach, how was your day today?
Been a really good
That's
Thanks for asking.
that's good. That's good. Tell people where you're from.
I am actually from Beaumont, Texas.
hmm
It's in Southeast Texas, if you're not familiar, because it's a smaller town.
hmm Where do you reside now?
Um, I still reside
Same
in
time.
Beaumont,
Okay,
Texas.
okay, okay. Now you're a mental health nurse. So can you explain to the people what a mental health nurse does?
Yes. So actually, the mental health nurse's job is different from the physical health nurse. So what our job mainly is to help you navigate
Mhm.
the mental health world. So when you come in to see the doctor, we some of us will do vital signs. It's not always the case, and then we'll determine what you need.
Okay.
Do you need to just go and talk to someone about medication, or do you need to talk to someone about therapy?
Okay. All right. So can you tell people some of the reasons why they should see a therapist?
Absolutely, yes. So since day one that we've been in this crazy world, we all of us have endured either now or will endure some type of trauma. So it's good to come in and talk with a therapist, whether you're going through a crisis right now or not. Because as like my therapist friends tell me, the time to come in and actually get treatment is before that happens. And it's okay if you don't, but before that happens, so you can have a baseline, a template already established, the tools to help you deal when those crises arrive.
Right, right. So how do you go about finding a therapist that you're comfortable with?
So, depending on where you are, everywhere in the U.S. that I know of, and I know in some foreign countries, they have things established as well. Most of them, but depending on where you are, there are usually a local agency that provide mental health care, and you can usually find them on Google these days. That's the easiest way, or you can go to NAMI, NAMHI. That's a government website, and it will or Psychology Today,
Uh-huh.
and that will give you access to all of Psychology Today. Is more like the best one if you want to find providers in your area.
Mhm.
So then that will give you a list of providers, therapists, and psychiatrists that you can actually follow up with about getting care.
Okay. So speaking to the melanated community, because I know that they frown upon going to therapy. So how do you get them to that point where you're like, okay, we need to see a therapist, we need to go talk to somebody. How do you kind of,
Mhm.
usher them into therapy?
So it's great that you asked that question because that is the idea that my coaching practice is actually built upon. You will
Mhm.
be surprised. Even the professional people that are apprehensive to seeking therapy for I'm sorry, but some of the right reasons,
Yeah.
we've endured a lot as a community. And so we don't trust easily. And that's the main thing there, the trust. I make it my point to try to silence the stigma. My coaching practice gets you ready for that next step.
Okay.
So I kind of am like a gateway to getting you into care if you need to get into care, rather that's if you need to be passed on to the actual therapeutic part,
hmm
then I can pass you on to my trusted therapist, LPC, psychology friends. Or if you need medication, I can pass you on to those that I trust.
Right.
And all of those people look like us. So that's another thing. It's important. A lot of times you'll find for you to actually go to physicians
hmm
and therapists that actually look like you,
Right.
it does help. And there are a lot of us out there, and and more of us are making it our point to be available to our people. So I help with that by explaining to you what that is when
hmm
you come for a session or schedule a session with me because I work virtually,
Yes.
and kind of helping you navigate and understand what some of those terms actually are and what signs and symptoms you may not seen or to look for.
Okay. Yeah, because a lot of people, like I said, they're very hesitant about seeing a therapist, but they'll go to a doctor and you say therapy, it's like, I'm not doing
Yeah,
it. Not doing it.
Yeah. We think that therapy is for crazy people.
Yeah, and
That's not
it's
the
not.
case.
It's not.
And then what's a crazy person anyway?
Right. Right. So as for yourself, did you get to the point where you felt like you needed to go to therapy?
Absolutely, absolutely. My practice is founded on I do not ask or give people advice that I would not be willing to or have not taken myself. So yes, I have actually been in therapy, still in therapy. My children and my husband were all in therapy,
Hmm.
and life is good right now.
That's good.
But I'm in therapy
That's good.
because I need it.
That's good. Hey, first thing is what they say, admitting it. First step is admitting
Mhm.
it. So,
Right.
so as far as how did you being a mental health nurse basically birthed your coaching program?
So, in this wild and crazy world of mental health, I noticed firsthand that I would spend a lot of time doing teaching on the back end of the appointment. When the people would come in to see the doctor, they would have no idea a lot of times how they got there.
Um,
And I'm like, so your doctor just scheduled this appointment and didn't tell you? I don't understand how that happened. But they would have no idea really on why they're sitting there. And so that led me to believe that somebody just said you need to come talk to someone, but they didn't explain why. So I would help them because we have like a little preliminary questionnaire that they fill out.
mhm.
I would help them understand the reasons why their PCP, forward them over to come see the mental health team.
Okay.
Whether that be they're not sleeping well, so we want to make sure they cleared them. It's nothing physically wrong with them. It's most likely something mental going on, or maybe they have like a diagnosis that's gonna have some anxiety or depression long haul attached to it. Like the easiest one is cancer. Cancer patients get depressed easily. So they forward them over to get the treatment now.
Yeah,
And then after they go talk to the doctor and the therapist, both of them, not just one, they have no idea what they just finished talking about when they walk out the room. They don't know what they're supposed to do.
that's so sad.
Even if, especially with the medication.
Yeah.
And I can understand that because I do a whole live series, but I can understand that because mental health medication is a little bit different
Mhm.
on the facts of how it's going to actually work.
Mhm.
But the doctors could do a little bit more education with that and scheduling appointments with their nurses, but they don't. And then as far as therapy,
Mhm.
where therapy and coaching differs is the therapist tells you the things that you should do. They give you homework on all these things to do.
Okay.
So when they leave, um, when you leave them, they've identified something. Y'all have discovered something
Okay.
and what y'all are going to be working on. You create a plan, and they're giving you homework, and you're supposed to go home and do that homework.
Okay.
Well, some like go back to school. Some children can do their homework alone, and some of us is going to need some help.
Right.
So when you're dealing with something as serious as the health, a lot of times we need help, even with our physical health. So that's where I come in, and I help people with that because in the corporate world, as a mental health nurse, I spent a lot of time doing that because they just had no clue,
Yeah.
and they're like, some of them you could see it in their eyes, and they wouldn't say anything. And then you can see the frustration with the therapist because they're like, I don't know what to do. I don't know what else to do. And it's like as a nurse, we just kind of have that sixth sense and relationship with the patient where they trust us. They know we're going to be honest.
Yeah.
And they will tell us things they won't tell the doctor or the therapist. So I've seen that gap that actually
Okay.
can be and needs to be closed.
Yeah. Well, that's awesome because sometimes you need an advocate or you need someone to break it down in layman terms because we didn't go to school to become a doctor, so we don't know these words. We don't know what's going on. So sometimes you need someone to
Yes.
break it down to you, and then
Mm-hmm.
sometimes I'm sure you met so many people they're probably alone and they don't have anybody.
Right.
So,
Right. If you have a support system, I didn't realize it,
mhm,
but if you have any kind of support system, you just don't realize how blessed you really are.
right, that's so true. That's so true. Yeah.
Hmm.
So this was great, and we got a lot of information because I've never heard of a mental health nurse. This is my first time ever hearing of a mental health nurse, never heard of
Hmm.
it. So I think this will be really good for the listeners and the viewers, because we don't talk about it. And
Right.
if it does get talked about, it's kind of like, oh, she crazy. Yeah. But it needs to be talked about a lot more. You go to a doctor for your body. You go to a doctor for your eyes. Like you go to a dentist. Why not for your mind?
Absolutely.
It definitely
Yes.
needs
And
to be
that's,
talked about.
yes, yes. And I'm like, that is a muscle that we overuse.
Right.
You cannot do anything without the brain.
Right.
Absolutely.
Right. That is so true. Well, thank you for being here. I really appreciate it. And it was nice.
Thank you.
And I want to thank y'all for listening and for watching it. And I'll talk to y'all next time.
Bye.